Yes, glaucoma is glamorous in the sense that what you see is just the tip of the iceberg, and there's a lot more which you can explore and understand about glaucoma. I was always very fascinated by this specialty because of its complexities and was always keen to be associated with patients of glaucoma and to do a fellowship in glaucoma. However, it was not possible for me to do a fellowship that time, and I opted for senior residency at Dr. Shroff's Charity Eye Hospital. However, to my dismay, even after completion of a successful comprehensive residency, there was no job opportunities for me that time. The trend of the fellowship had already started, and even our hospital was looking for consultants who had fellowships. So that was a huge setback for me. However, I am very thankful and grateful to our management that time, and especially the CEO, Dr. Stephen Roy, and Dr. Shroffs, who believed in my potential that time and gave me the opportunity to serve the hospital in the capacity of a consultant. They also gave me the opportunity to do a fellowship at the very prestigious Willis Eye Institute under the able guidance of the stalwart Professor Dr. George Spaeth. And that was like a dream come true for me. So that was the beginning of my career or my journey in glaucoma. I find glaucoma very fulfilling and rewarding. And what keeps me going every day in my clinic is the realization that I was able to make some difference in the progression of the disease and preventing loss of vision. I'll give you one example of one of my old patients who came to me with his son. And when he came to me, he was very depressed and he even lost interest in his life. He was suffering from advanced glaucoma and cataract, and his son requested me to treat him. Very hesitantly, I performed combined surgery for him, and to my surprise, he improved miraculously after surgery and could resume his reading, and he was a happy person again. And his son even commented that, "Doctor, you have improved the quality of life of our family. Now my father is smiling again, he is reading and he is behaving like a normal person." So as a glaucoma specialist, you can contribute a lot in diagnosing the disease early and treating the disease on time and make a huge difference in the society. So I'll start with a quote which I strongly believe in. Success is not a matter of spontaneous combustion. One must deliberately set oneself on fire. My passion lies in learning new surgical techniques and procedures and enhancing my surgical skills. And I was fortunate enough to get a chance to learn new techniques through Orbis International. I learned tube implants and management of pediatric glaucoma way back in 2004. And more recently, I got the opportunity to learn the latest MIGS technique, Trabectome, and which was the first in India. So it keeps my passion and energy going when you are learning something new, that you cannot achieve success without having a strong team. For me also, organization played a very crucial role. So basically it's a win-win situation for yourself and for the organization when you achieve something. But in the end, it requires a lot of focus, dedication, and commitment to achieve success. So like every other woman, the biggest challenge, especially during my initial days, was balancing the home life and the work life. And the biggest challenge came when I got the opportunity to do a fellowship at Willis Eye Institute, leaving my 5-year-old son back home. And there was a lot of emotional turmoil. However, I was able to overcome this by strong support, both emotional and otherwise, of my family and my husband. Another big challenge came when I had to establish myself as glaucoma specialist and establish the clinic at my organization. Again, there was no mentor at that time who could help me establish the clinic successfully and guide me through. However, I am thankful again to my organization and CEO, Mr. Arora, who helped me to learn different perspectives and strategies and the nuances of leadership to achieve the ultimate goals. I feel glaucoma is one of the best career choices, as pursuing glaucoma fellowship makes you a true comprehensive ophthalmologist and an astute clinician. There are very few fellowship trained glaucoma specialists in India, and that is the reason why there is so much of underdiagnosis, wrong diagnosis and inadequate treatment for glaucoma.